Hello, everyone. My name is Dr. Claudia Munoz. I am the Medical Director for Neurosciences here at Emanate Health. I am a neurohospitalist. That means that I am the person you see if you come into the hospital with anything that sounds like it could be a neurological or brain issue. So today, this is my very first live, without a studio audience, show or talk. So as you can tell, I'm very new to this, but I'm super excited. Why am I excited? I love brains. I love brains, I love spinal cords, I love everything to do with the central nervous system, and I really care about your brain. I know that sounds cheesy, but I really actually do care. I want everyone to stay healthy, I want everyone to stay strong, I want everyone to live their best life. And my job, one of my jobs, is to help you learn how to do that. So today I'm going to be talking about stroke. We're going to learn about the basics of stroke. I would like for everyone to walk away from this understanding a little bit better the concepts about stroke and how to recognize them. Then we'll answer some questions. So what I want you to do is, if you have any questions, type them into the chat box. I have some great people here who are going to be passing me the questions, and I will do my very best to answer them. I may not have all the answers for you, but I will do my best. And let's do this. So today's talk, we're going to call it Recognizing and Understanding Stroke. At times, I'm going to tell you to look at your screen, not at me, and I'm going to try to do my best to tell you exactly what I'm looking at so that you guys get a better understanding of a few key points. All right? So let's all read this together. What is a stroke? A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. Ruptures is the other word for bursting. When that happens, part of the brain cannot get the blood it needs, and so the brain cells that are affected by that die. There's different types of strokes. There's what we refer to as an ischemic stroke, in which there is a blockage or a clot that obstructs the flow of blood to an area of the brain. We've all heard of mini strokes, which are TIAs or transient ischemic attacks, and those are caused by the same mechanism, a clot, but it's small enough, or for whatever reason, we don't understand why, it dissolves. The body is able to take care of it by itself. So it's a transient event. The other main type of stroke is a hemorrhagic stroke. A hemorrhagic stroke is just what it sounds like. A blood vessel bursts and there is a hemorrhage in the brain. When that happens, it's the same thing. So the part of the brain where the hemorrhage is and downstream from the hemorrhage also is affected because the flow of blood and nutrients is disrupted. Okay? So two different types of stroke, ischemic and hemorrhagic. Ischemic is by far the most common kind. It accounts for about 87, almost 90% of strokes. But both can be quite devastating to a person. Big point I want to make. Stroke is an emergency. Do not delay your care. You're going to hear that several times during my talk. Okay? I want to really drive home that point. Why? Stroke is the 5th leading cause of death in the United States. I know you don't think of dying from stroke. People think of dying from a heart attack. But you can die from a stroke too. If it is large enough or in just the right place, or I should say the wrong place, it can cause truly life-threatening events to happen both in the brain and then later on complications in the body. Okay? Stroke is a leading cause of serious long-term disability as well. So we have gotten technology, medical advances that we're very good at keeping people alive. But what happens afterwards? There can be tremendous disability, and no one wants that to happen to a loved one or to themselves. So stroke is an emergency. Do not delay your care. So let's talk about some neuroanatomy. Like I said, I love brains. I could talk about this all day. In fact, I'm at home. I'm working on like a brain model with my kids. We'll try that out the next time. So what are the effects of a stroke? The effects of a stroke on any given person depend on several factors, okay? Where is the stroke? The location of the obstruction. So remember when I talked about an ischemic stroke being caused by a clot or an obstruction? So where that happens affects the brain tissue downstream from that. And then also how much brain tissue is affected. So strokes can happen in smaller sizes, medium, large, very large, you name it. And so that is obviously going to have an effect on the seriousness, the variety of symptoms that you may experience. Each individual is unique, though. So I often get, well, my friend had a stroke and it was nothing like what happened to me. Well, everybody is unique, and everybody is going to have potentially different symptoms, and your stroke may not have happened where your friend's stroke happened. So just bear that in mind. Don't stress out. I will not be testing you on this. It took me years to learn this myself. This is just to give you an idea of the tremendous complexity of our brains. There are areas that are dedicated to our motor system, meaning the brain telling the body to move, sensory function, which is when somebody touches you, any sensation that you feel. There's areas dedicated to language, to vision, everything that we do, even functions that we never think about, like breathing, our heart beating. Those are all regulated by centers in the brain. And so depending on where that stroke is what is going to be affected. Now, this is a little bit simpler slide, but very important too. This is the blood supply to the brain. So I want you to look at your screen again. I want you to look at this. So if you're looking towards the bottom of that diagram, you see the aorta. That's the big artery that comes off of the heart. Below that is the heart, right? So everything is connected, right? So then you move your way upwards, and vessels go up the neck, in the front and in the back. And then there's branches that come off into the anterior part, or towards the front of the brain, and the posterior brain towards the back. So let's imagine now there's a clot. Let's say you have atrial fibrillation. Has anyone heard about that? You can tell me in the chat box. But it can be one cause of small clots going up to the brain. So let's say you have atrial fibrillation, a small clot forms, and it travels up one of the carotid arteries. So you look there, you can see on your screen the carotid artery. And let's say it goes up the right carotid artery and up into what we call the middle cerebral artery. And then there's branches of the middle cerebral artery. So the clot then gets stuck because it can't get any farther. All the area of the brain distal or downstream from that clot is what is affected. So very important for you to understand this. The entire vascular system is connected. And, think of it as a brain attack if that's easier for you to think of. Just the same as a heart attack. It's all the same blood vessels. So we got to take care of those. Next. All right, recognizing a stroke. Now we've talked about different brain functions. We've talked about how a stroke can happen and the variety of different symptoms that you may have. So we've got this really great little easy to remember chart with possible but very common effects that a stroke can be happening. So let's go through it. I want you to look at your screen again, and we're going to say this together. Be fast. One more time, be fast. All right, so B, balanced. People don't think of this very commonly, but a stroke can affect your balance, right? All of a sudden, maybe your physical weakness isn't so bad or so different, but all of a sudden you're like, I feel so unbalanced. The room is spinning, or I feel like I am moving and I can't help myself. I'm stumbling. Okay, that could be a stroke. I want you to remember that. Balance, very important. Okay, E is for eyes. Sometimes, also not so common, but can happen with a stroke, particularly in the back part of the brain, you can have what we call double vision, diplopia. That's the fancy doctor word. And that, again, people will say, all of a sudden my eyes weren't working, or I was seeing double, or very commonly as well is the vision in one of my eyes went out, or I couldn't see the wall. I kept bumping into stuff because I couldn't see it on my right side or on my left side. These are potentially, again, symptoms of stroke. Another one, we're getting to F now, is facial asymmetry. So all of us have some asymmetry to our faces. We're, products of nature, and, we're not perfect. For example, every morning when I put on my eyeliner, I notice this eye is a little droopy and whatever. But with stroke, you can have sudden onset of one side of your face just not looking right. Sometimes what people will perceive is the opposite side of their face looks like it's being pulled, when in fact it is normal, but this side is drooping downward. So very important to act on that quickly, okay? Potentially it could be a stroke. There's a few other things that could cause similar symptoms, but better to let me at the hospital or some of our other excellent neurologists help you determine that. Next is A, so arm drift. One of the most common type of strokes is an MCA stroke. Now, that will often affect the strength in your arms. So you can say, if you're feeling all of a sudden weak or you think you might be having a stroke, put your arms up. And if one of them starts to drift, that potentially could be a stroke. Okay, there's different reasons. Some of us may have bad shoulders, a variety of reasons for this to happen. But if you feel weakness on one side of your body, not all over necessarily, but one side of your body, I want you to really be thinking in terms of getting yourself checked out ASAP. Next, speech. So like I said, oftentimes the face can be affected. The muscles of the mouth, we don't ever think about them, but the tongue is a very complex muscle. It has its own innervation, nerves that come off of the brain. The muscles of the face are also potentially affected by strokes. So if you find yourself slurring your words, words aren't making sense, sometimes if your language center is affected, you can start talking like a word salad, like words come out but they don't make any sense. Or you know what you want to say, but you just cannot make yourself say it. Very frustrating. But those are definitely things to worry about and reasons to get in to see the doctor right away. And not call and make an appointment for 2 days from now. I mean, get to the hospital, okay? Next, time. Time is money, they like to say. Well, what I say, time is brain, okay? Every second of a stroke costs millions of brain cells. So do not delay your care. Call 911. Okay, very, very, very important. I'm going to pause here for a second, and I want to talk about a couple other things that people often don't think about. These are very different times for us with COVID. COVID has brought many different changes to our lives. It's scary to go out. It's scary, the thought of coming to the hospital because you think, oh, I'm going to be exposed. Also, the other thing is people of all ages are getting COVID, all ages. And one of the very unfortunate effects that we're learning that COVID has is it can make your blood more likely to form clots. So what does that mean? People of all ages can potentially have a stroke. That was true before COVID, but now with COVID, it's particularly true. Okay, so even if you are not in an age group where you would think you might be having a stroke, it's best to just call 911, get yourself in to see the doctor here at the hospital. Really, we are here. We're ready for you to come in. It does not bother us. We want to see you. We want to help you. We've taken every single precaution to keep everyone safe. We have all of the protective gear that's needed. You as a patient can feel confident that here at Emanate, we are open, we are clean, we are safe. We're here to take care of you. All right? I just really want to drive that home. Do not delay your care. All right, so what are some risk factors for stroke? This is really important, not just for you as a patient, but for the people who help take care of you, or for those who love you and are around you, and who also want to take care of themselves. Risk factors. So there's some things that we just can't control. Age. Much to my chagrin, I cannot stay 27 forever. So, as we get older, risks increase. Okay, every 10 years, the risk doubles after the age of 55. So I know that sounds scary, but it is what it is. And we roll with it, right? Gender, 60% of strokes are actually in women, okay? Stroke is more deadly than breast cancer. And we always think of women with other types of issues, but stroke is a huge potential life event in a woman's life. As far as gender, though, after the age of 80, men seem to be more susceptible, more at risk. Okay. Next is race. There is a greater risk if you are Black, Latino, Native America, Alaska Native. We're not really sure why. There's many social and potentially genetic factors. That is still many questions to be answered in terms of that. But just know that if you're someone like me, I have to be very cognizant about my own health, try to mitigate my own risk factors, and hopefully, I will never have, this type of life event. And then there's genetics and hereditary. In some families, this is just what happens. Some families, they have heart attacks. Other families, they have autoimmune diseases. And in some families, it's stroke. So, like I said, some things we just can't help. But there is a lot of stuff that we can control. All right? Cigarette smoking, bad. If you smoke, please stop. Heavy alcohol use, diet, and the physical activity. So, then there's also the things that your doctor can help you control. People like me, your primary care doctor is your absolute #1 first line for stroke prevention. Hypertension or high blood pressure, sleep apnea. People don't really often don't recognize, one, that they have sleep apnea. You wake up, you're tired all the time. Your spouse is like, oh, you snore so loud. I'm going to go sleep on the couch. Sleep apnea, if treated, will make your life so much better. If untreated, sleep apnea is a definitive risk factor for stroke. Vascular disease. We mentioned atrial fibrillation earlier. Cholesterol, and diabetes. Everyone has heard of diabetes at this point. That is a very serious risk factor for stroke. So let's focus on the things that you can do. Exercise, low salt diet, low cholesterol diet, quit smoking if you're a smoker, and I mean totally. Go about it the best way that you can, get help, but quit smoking. Even 1 or 2 cigarettes is not good, okay? And medications. Like I said, your primary care doctor is really your first line defense. So, exercise. I am a huge fan of exercise. I try to do something every single day. It makes me feel better, I sleep better, and I'm happier. And if mommy's happy, everyone's happy, right? So, American Heart Association recommends 150 minutes per week You can divide that up however way you want. That will reduce your risk of stroke by up to 30%, almost a third. So it's a small effort for a lot of reward. It'll improve your blood pressure, your diabetes will be under better control. Like I said, you'll sleep better, and you'll just feel better overall. Salt. So we often do not think about where we get our salt. The biggest problem is processed foods. I know they're easier, they're more convenient, oftentimes cheaper, but let's try to focus more on fruits and vegetables, trying to do our own cooking, mitigating how much salt we use, and that'll go a long way as well. So high salt diet, something like 5 grams a day. So there's 2.5 in a teaspoon. So as little as 2 teaspoons throughout your day really increases your stroke risk by 23%. So that's almost a quarter, right? So like I said, keep an eye on the salt. Fruits and vegetables, low cholesterol diet, lean meats, fruits and vegetables, whole grains, dried beans. Try to use the lighter oils, or maybe just do a light spraying. You'd be surprised how far just a light spray of oil can go. And your food will still be really, really tasty. I promise. And smoking, I cannot say this enough. Smoking doubles your risk of stroke. It accelerates the development of atherosclerosis. That's a very fancy word for plaques in your arteries, for blockages in your arteries. And remember, if you go back to that diagram, blockages in the arteries cause stroke. That is a direct cause for stroke. And it can also constrict your blood vessels. So if your pipes are tight and you smoke and it makes them even tighter, no good. Taking your medications. So these are 2 funny pictures of myself. I want to make you laugh, but I really do worry when people don't take their medicine. So that's me. When you say, yes, doctor, I take my medicine, I take it on time every day, I do not miss doses. And then me, when you tell me, well, sometimes I do, sometimes I don't, I'll miss some doses, I'll run out of medicine, I'll take a couple of days. Why do I worry? There are some medications, especially some of your blood pressure medications, where if you miss doses, there's a rebound effect. And what that means is your blood pressure shoots straight up. That is a very, very dangerous thing to happen. That is when the majority of ruptured blood vessels happen. Remember hemorrhagic strokes? Extremely important. You're missing your diabetes pills. That has very terrible effects. And can also, like push you over the edge. So it's not like, we're all on a diet and then we have a cheat day and it's okay because it doesn't make a big difference. Sure. But with your medications, there can't be cheat days. So what I want the take-home points to be, stroke is an emergency. Do not delay your care. Don't delay, call 911. Okay, go to the trouble. People tell me all the time, oh, I didn't want to cause a ruckus, or I didn't want to cause anybody any trouble or inconvenience. You're not inconveniencing anybody. You are worth the trouble, okay? Call 911. Get yourself in to see somebody right away. And you can do a lot to prevent stroke, okay? So don't delay your care for anything. Stroke is an emergency. And right now, if anyone has any questions that you've tabbed in, I can take them. And I have, do all strokes cause permanent damage? So there's 2 answers to that question. Once a stroke happens and there has been damage to an area of the brain, yes, that is permanent. Unfortunately, brain does not grow back. Now, what you're probably asking is, will I have the symptoms permanently? That depends. That depends. Like I said, everyone is unique, and it depends on the size of the stroke, the location of the stroke, and you as a person, and what your underlying health status is. Also depends on your age. As we grow older, we lose what we refer to as brain plasticity. So that's the brain's ability to form new connections. Because when you have a stroke, it's not just that brain tissue, it's all of the connections in the brain that get disrupted. It's like highways in the brain, areas talking to each other. So if a highway gets disrupted, as we grow older, we don't have as much ability to, form a new highway. So the answer to your question, unfortunately, isn't a yes or no. It depends, and there's a lot of factors. So the best thing to do is everything we can to mitigate our risk factors. Can stroke affect younger people? Yes. There are different types of strokes. So like I talked about with COVID, we have seen an increase of stroke in younger people. But even before COVID, young people may have a genetic susceptibility. Some infections can cause stroke to occur in younger people. Certain hormone imbalances can cause stroke in younger people. And, in our society today, unfortunately, younger and younger folks are getting chronic illnesses such as diabetes, such as high blood pressure. So, that may affect someone particularly badly, and they have a stroke as a cause of it. So just because you aren't your typical, elderly gentleman, doesn't mean that the symptoms you're experiencing couldn't be a stroke. So take them seriously, take care of yourself, and don't delay your care. David from New York, hi. All right. What about investigational therapies? So this is one of the questions that I don't have great off the top of my head answers for. I do know that, there's always new technologies being developed. We started off, many years ago with IV-TPA, which is alteplase. It's a clot-busting medication. We are developing new medications that may actually be more effective, and those are just now becoming available. We here at Emanate are becoming thrombectomy certified. So what is a thrombectomy? Remember when we looked at the blood vessels going up to the brain? In some instances, not in all, but in some instances, an interventional radiologist or neuroradiologist can go in with a certain device and retrieve that clot and open back up the vascular flow to the brain. But it's extremely important for you guys out there to understand time is extremely critical. So if you come in too late and that stroke is completed, there is nothing we can do about it. Okay, so fast to come in, and we can evaluate you and see if you are a candidate for any of our interventions. Thank you. What do caretakers need to know? Rachel from West Covina. Hey, Rachel. So, really great question. Caretakers, you are with your person, the person you care for, a lot. You know that person. You know that person very well, better than what I would know. And then a lot of times you are the person who's organizing their medications, keeps track of them. So, if you think something is off, trust your gut, trust yourself, call 911, be informed, keep a list, extremely important, keep a list updated with all of the medications, all of the patient's doctors' names and numbers and what they take care of for that patient. But really super important is just understand that if you see something that's different, don't delay. Just call 911, get them in to see us. Feel safe that you can come in too, and help us get a really great handle on what could be happening with the patient. All right, guys, so what's the take-home point today? Don't delay. Stroke is an emergency. I care about your brain. I want to help you stay strong and healthy. And thank you for the opportunity to do this. It's super fun for me, and I look forward to doing it again in the future. Bye-bye.